be performing the active straight leg raise test with and without compression to take a look at SI joint dynamic mobility. So what we're going to do here is we're going to be performing this test on both legs. We're going to be doing this with Chase doing it without any force from me, and that would be for the active without compression, and then I'm going to go ahead and provide a compressive force to the pelvis, which would be with compression. So what I want Chase to do is tell me the difficulty of how it is to perform this, 0 being the easiest, 5 being the hardest, and the provocation of symptoms or pain level that Chase is experiencing. So he's going to go ahead and have his arms by his side. I'm going to go ahead and have you raise your leg 6 inches off the table. We're looking for quality of motion here. I'm looking to see if Chase's core is braced, if he's having any compensation, hyperextension of his back, any rotation of his pelvis, and his quality of motion looks good. From a 0 out of 5, how difficult is this to perform?
1.
Okay, I'm going to go ahead and have him relax the leg and do the same thing on the other side. So again, I'm looking for quality of motion, looking at his pelvis, looking at his leg. Is he trying to compensate? Looking at any issues with his core, bracing, or disengagement. Out of 0 out of 5, how do we feel?
1.
And go ahead and relax. From here, I'm going to go ahead and move to my compressive force. So I'm going to provide a posterior compressive force of Chase at the pelvis, and go ahead and perform the same for me. From a 0 out of 5, how difficult is that to perform?
1.
Again, looking for quality of motion, especially at Chase's pelvis and his core. Go ahead and lift the other leg for me. Out of a 0 out of 5, how does this feel?
1.
All right, and go ahead and relax. So if Chase had improved by 2 points or more when I provide that compressive force, that tells me that for treatment, I will use a belt to help stabilize his pelvis. If not, then I can use neuromuscular re-education at that point.